Immunotherapy treatment works by making the body's immune system become more active, so it is better at finding and killing cancer cells. Sometimes the immune system can become too active and cause unwanted side effects in other parts of the body. The side effects from immunotherapy are very different from those caused by chemotherapy, as they are due to inflammation. There are many immunotherapy treatments, and each one can have different side effects. This film explains some of the more common ones. It is important to also read the information you have been given about treatment you are receiving. Immunotherapy side effects usually happen in the first weeks or months after starting treatment, but some can occur later, even after treatment has finished. Side effects in many cases are mild to moderate, but some can be serious and life-threatening. You may not experience any or all of the side effects that can occur. Some people have only mild side effects and others have more serious ones. In this film, this is shown by the use of colours. Green is mild, orange is moderate, and red is severe and serious. Many immunotherapy side effects are temporary and can be managed if they are reported early. They need to be treated by staff who are experienced in managing them. It is important to tell the doctor, nurse, or pharmacist in the chemotherapy team if you have any side effects or notice unusual changes in your health. Please ring the advice line in between your appointments if you have any concerns, as the assessment nurses can help you manage symptoms. If you need to ring the advice line, the number is on your alert card and on your patient information. Immunotherapy can cause skin reactions. The type of reaction depends on treatment you are receiving, but possible skin reactions include dryness, itching, rashes, discomfort and pain. Sometimes peeling, blistering or breaks in the skin can occur, increasing the risk of infection. It is important to ring the advice line and tell the nurse or doctor when you come for treatment if you have any breaks, pain or blistering of the skin, or spots or pimples that are producing any fluid or pus. There are things that can be done to manage skin reactions. Please ask for advice. Skincare tips and advice include using a perfume-free moisturiser regularly when you start your treatment, and use mild, non-perfume products when you shower or have a bath. It is very important that you protect your skin from the sun when you are on treatment. Try to avoid being out in the sun as much as possible. Apply high-factor sunscreen when you are outside and wear sun-protective clothing. Some immunotherapy treatments can cause inflammation, cracking and blistering of the skin on the fingers and feet. This can become very painful and get in the way of you being able to carry out your usual daily activities. These are called hand-foot reactions. If this is a possible side effect of your treatment, you can use moisturisers on your feet and hands as you start treatment. If your skin becomes broken or peels or becomes painful, please ring for advice. Hormones control many important functions of the body. Immunotherapy can affect the production of hormones so they are not controlled properly. Hormones that are affected by immunotherapy include steroids, thyroxine, and insulin. These hormones are all essential for producing the energy our body needs. Signs of problems with hormone production depend on which hormones are affected, but they also include sweating more than usual, feeling more hungry or thirsty, tiredness, headaches, low blood pressure, fast or irregular pulse, raised blood sugar and difficulty sleeping. Your hormone levels will be monitored with blood tests during treatment and can be treated with medications if affected. Hormones are vital for keeping us well, and problems with hormone production can be life-threatening. Please seek advice if you develop these symptoms or notice unusual changes in your health. Sometimes immunotherapy can cause inflammation of the bowel. Symptoms of this include diarrhoea and stomach pain. If you have a small amount of diarrhoea, you could take anti-diarrhea tablets and drink plenty of water to replace the fluid lost with the diarrhoea. If the diarrhoea does not improve, the amount increases, or you develop stomach pains, please ring for advice. Early treatment of this symptom is essential. Immunotherapy can cause inflammation in other organs, including the liver, kidneys, lungs and heart. Problems with the liver and kidneys are often picked up by the routine blood tests that you have before your treatment. Symptoms to look out for include feeling very tired, passing a lot less urine, which is a sign the kidneys may be affected, or yellow colouring in your eyes or on your skin due to liver changes. Signs that could suggest a problem with your heart or lungs due to immunotherapy include breathlessness, cough and tiredness. Other heart symptoms include an irregular heart rhythm, high blood pressure and chest pain. Immunotherapy can cause inflammation of the lung. This is a rare side effect, but it must be treated quickly. If you become more breathless than usual when doing activities or when you are at rest, please contact us immediately. People with cancer have an increased risk of developing blood clots such as deep vein thrombosis and pulmonary embolism. This can also be increased by being on immunotherapy. The symptoms include pain, redness and swelling in one arm or leg. It can also cause shortness of breath. Contact us immediately if you develop these symptoms. Fatigue is a very common side effect of immunotherapy, experienced by most patients. There are very helpful booklets available that contain advice on managing fatigue. Please watch our film Living Well During Treatment for further advice. Tiredness can also be a symptom of some or other side effects of immunotherapy, such as hormone changes and inflammation of the kidneys, liver, heart or lungs. If you find your fatigue is not relieved by resting or you are having a big impact on your normal activity, please contact us. Treatment for immunotherapy side effects can include having a break in treatment to let the side effects settle and medication to reduce the activity of the immune system. Reporting symptoms and managing them early is vital to reduce the potential harm from other immune reactions that might develop. Please let us know if you have any symptoms that could be side effects when you have your appointment, and remember to ring for advice so we can work together to ensure you have your treatment safely. There are many immunotherapy treatments and each one can have different side effects. This film explains some of the more common ones. Do also read the information you have been given about the treatments you are receiving and ask the team if you have any questions. Some people have a combination of treatment and may have chemotherapy as well as immunotherapy. We have a film about chemotherapy. Please watch this if you are having both types of treatment. If you are not sure, please ask one of the nurses.